Hi guys, Dr. Sean here. Hope everyone's doing okay. So today I'm going to be talking a little bit about dental implants. I'm going to be going over the process of dental implants and what happens before, during, and after. In general, the process is painless, but it can take a while to complete the entire procedure from start to finish, meaning from extraction all the way into the final restoration of the implant crown. So in terms of process, step one, most important process, is the comprehensive exam. An exam will need to be done first, including x-rays, impressions, shade matching. The dentist will examine the bone, the implant site, and determine what implant and procedure would need to take place. Also during this initial exam, you're going to go over the medical history of the patient, which is very, very important. We have to make sure there's no contraindications to having an implant placed. Okay? Now, step two is the extraction of a tooth, if there needs to be. If there is a tooth that needs to be extracted, this will happen next. Depending on the case, this can be done before the implant placement, or sometimes it can actually be done at the same time, so the dentist can actually extract the tooth and then place the implant in the same day. Now, during the actual extraction procedure, the dentist will obviously anesthetize the patient and then extract the tooth and give them the post-op instructions. Okay, step three. This is actually the dental implant placement and a bone graft if it's needed. Now, if a bone graft is not needed, then the implant can be placed right away. But if a bone graft is needed, then this can be done before placing the implant or even during the implant placement. If the bone graft is placed before, then usually the patient will have to wait several months for the bone to strengthen, and then the dentist can go ahead and place the implant. After the implant is placed, it can take about 3 to 6 months for the next step, okay? And that next step is step 4, which is placing an abutment. After the implant site is stable, then the dentist will place an abutment on top of the implant. The abutment connects the implant to the crown and also helps keep the tissue at a position necessary for the crown to set properly, okay? So this is a very important part of the process as well. And then finally, step 5. After everything's healed, the gum, bone, implant looks good, then the crown can finally be fabricated. There's 2 options for implant crowns. There's screw retained or cement retained. The screw retained will actually show the access hole slightly, even if you fill the hole with the filling material. But they give you the best option to access the implant if ever the implant actually has to be retightened because it becomes loose, for example. Now, the cement retained has no access hole, so it's going to be much more cosmetic crown. You won't be able to see any kind of dark hole area, but if for some reason something does happen to the implant where it needs to be tightened, then you actually have to go ahead and destroy the crown to get access to the implant. But all in all, choosing dental implants is an expensive, but it's a very wise choice. It is an expensive procedure in the short term, but if you're looking in the long term, it's one of the most long-lasting restorations. But yeah, that's about it. So there you go, a little bit more information about implants and the process there. If you have any questions, please let us know. Thanks, guys.